All right. Hi, my name is Iyer. I'm a second year postdoctoral research fellow in the Division of Population Sciences at the Dana-Farber Cancer Institute and the Department of Epidemiology at the Harvard T.H. Chan School of Public Health. I got interested in cancer epidemiology while working for a nonprofit called Partners in Health in Rwanda. And so I lived there for 2.5 years. And this organization was setting up a state of the art cancer hospital in the middle of a rural part of the country. I became very interested in some of these aspects of healthcare delivery that my colleagues were focused on, but also about how data was really, really important, both for delivering good care, but also for understanding the drivers of cancer risk in different populations. And so from that, I decided that I wanted to do doctoral training and then later on do postdoctoral training in cancer epi. I'm really interested in trying to understand the multi-level causal pathways that link neighborhood contextual environments, so things like socioeconomic environments and the built and physical environment, to downstream cancer risk and cancer outcomes. And my research focuses predominantly on prostate cancer, in part because it's a cancer that we have struggled to find modifiable risk factors for many forms of prostate cancer. And there are also very, very stark racial disparities. Black men have over twice the rate of mortality compared to white men, for reasons that are really complex. It poses a really kind of unique challenge, I think, to a lot of us in prostate cancer research, try to bring everything we know about some of these causal mechanisms, but also to be very clear about what the pathways are that we need to intervene upon. And to give a concrete example of some of the projects I'm working on in the space, one set of projects is looking at biomarkers that typically we tend to see prior to the development of cancer. So here at the Harvard School of Public Health, as a postdoc, I have access to some of these really incredible data sets that have been collected over 40 years, where we have address information for people over time, and we can study these prospective associations between some of these neighborhood environmental features like socioeconomic status, income segregation, green space, and some of these inflammatory markers. And so that's some of the work that's kind of top of mind right now. In addition, I'm very interested in how we can use some of these geospatial variables to think about delivery of care. And so I recently was awarded a grant from the Department of Defense to construct a cohort of Black and white men with prostate cancer through multiple different states across the US, and link these geospatial features to start to better understand not just individual risk, but also communities. Because if we know where the communities are, we can start to think about where to direct interventions for screening, particularly for high risk individuals, of which African American men are in that group. There may be some benefits, provided we can really do a good job of balancing the harms of overtreatment against the benefits that would come from early detection. And so that's an area that I'm hoping to kind of think more about in the next few years. In thinking through schools of public health to apply to, I really wanted to get training in cancer epidemiology at an institution that would provide a lot of opportunities to get different perspectives from different fields of public health and how they approach this question. And I think the Harvard Chan School of Public Health really stood out because although there were researchers and scholars doing work that may not necessarily have been cancer focused, there were opportunities to learn some of the technical skills in those other areas that I could bring to the type of research I wanted to pursue in cancer epidemiology. As a doctoral student here at the School of Public Health, I was able to start to work with Dr. Francine Layden, Dr. Peter James, and Dr. Jamie Hart in the environmental epidemiology group, because they were doing a lot of work in the built environment, and they had a lot of skills in their team that I would hope to learn during my training. That would have been really challenging to get those collaborators to be involved in my research at other institutions. I think what sets the Harvard Chan School of Public Health apart is the breadth of different types of researchers and experts in so many different areas. As a person who came with a bit of experience from global health, started to develop interest in environmental epidemiology and geospatial analysis, but had a core interest in cancer epidemiology, this was really a great place for me to show up and just get involved, meet with people, talk with people, take classes in all these different fields of research, and really provided a unique opportunity to get these kinds of experiences. And I think that there's very few places that are really, really good at so many different things. And so it's just an amazing place to train.